And the most common kind of thing that looks like this in this area is called a sebaceous cyst.
Okay.
It's a cyst that forms in your skin, like your sweat glands and your hair glands. And then it can become kind of clogged up and acutely inflamed and painful.
Yes.
Okay.
Okay.
Sometimes these get really big, and once they get infected and inflamed like this, and they can work their way kind of up to the surface and turn into really big abscesses that you have to cut open and drain. Yours is not right there right now. Like it hasn't, because if you just look at your skin, it looks normal. Like it's not. When these get big, this is essentially what I'm trying to say is it's too small to drain right now.
Okay.
And too deep.
Okay.
Okay. But what we can do is put you on an antibiotic to help calm down the inflammation, and hopefully it'll resolve.
Okay.
Okay. There's a chance that it could continue to get bigger and bigger and painful, but then if that is what's happening, then probably in a couple days it'd be big enough to just cut open and drain, and that would fix it.
Okay.
Okay. But I suspect starting you on this antibiotic will clear it up.
Okay. Okay.
Yeah.
All right.
Okay. What questions do you have about that?
I really don't have any. I think you answered everything that I was concerned about. I was thinking that I probably need to be on an antibiotic because it's hurting, and I can feel it like spreading, or like the pain. It's just like everywhere on this side of my head. So I figured I probably needed antibiotics or something like that.
What happens when you take penicillin?
I get hives and itchy. So could they be like cancerous or?
It's extremely unlikely.
Okay.
You can never say for sure without biopsying something and sending it to the lab. But that's with something that looks like this, it's not.
Okay.
Okay. It looks very much like a regular simple cyst.
Okay.
Okay, that's extremely common.
Okay.
And I expect it'll clear up with antibiotics.
Okay, thank you.
If it gets worse, instead of better on the antibiotics, you can come back, and hopefully by that time it might be big enough to drain.
Okay.
All right.
All right.
Where do you want me to send your prescription?
The CVS is fine. The one right here.
Okay.
Yeah.
I'll send you an antibiotic, and then that should clear things up. Okay. All right. Any other questions?
That's it.